Shock treatment 101, shock treatment first aid. Shock treatment refers to the management and interventions used to stabilize a person experiencing shock, a critical condition where the body's organs and tissues receive insufficient blood flow. The specific treatment for shock varies depending on the type of shock and its underlying cause. Here's a general list of shock treatments. 1. Fluid resuscitation. Administer intravenous fluids, such as isotonic crystalloids, example normal saline or lactated Ringer's solution, to increase circulating blood volume and improve perfusion to vital organs. 2. Oxygen therapy. Provide supplemental oxygen to increase oxygen delivery to tissues and mitigate hypoxia, low oxygen levels, especially in cases of hypovolemic shock, septic shock, or cardiogenic shock. 3. Vasopressor therapy. Use vasopressor medications, example norepinephrine, dopamine, phenylephrine, to increase blood pressure and systemic vascular resistance, thereby improving perfusion pressure in distributive shock, example septic shock. 4. Inotropic support. Administer inotropic medications, example dobutamine, to enhance myocardial contractility and cardiac output, particularly in cases of cardiogenic shock. 5. Mechanical circulatory support. Implement mechanical circulatory support devices, such as intra-aortic balloon pumps, IABP, or percutaneous ventricular assist devices, example Impella, to augment cardiac function and improve hemodynamics. 6. Blood transfusion. Transfuse packed red blood cells to correct anemia and optimize oxygen carrying capacity, particularly in hypovolemic shock due to acute blood loss. 7. Source control. Address the underlying cause of shock through interventions such as surgical exploration, drainage of abscesses, or repair of ruptured blood vessels or organs. 8. Antibiotic therapy. Initiate broad-spectrum antibiotic therapy in cases of septic shock to target the underlying infection and prevent further progression of sepsis. 9. Pain management. Provide analgesia and sedation as needed to alleviate pain, anxiety, and discomfort associated with shock and its treatment. 10. Close monitoring. Continuously monitor vital signs, including blood pressure, heart rate, respiratory rate, and oxygen saturation, to assess the response to treatment and adjust therapy accordingly. 11. Intensive care. Transfer the patient to an intensive care unit, ICU, or critical care setting for close monitoring, advanced hemodynamic support, and multidisciplinary management. 12. Supportive care. Provide supportive measures, such as temperature control, glycemic control, and nutrition support, to optimize organ function and promote recovery. 13. Address complications. Identify and manage complications associated with shock, such as acute kidney injury, acute respiratory distress syndrome, ARDS, disseminated intravascular coagulation, DIC, and multi-organ dysfunction syndrome, MODS. Conclusion. Shock treatment involves a multifaceted approach aimed at restoring tissue perfusion, correcting underlying abnormalities, and preventing organ damage. Prompt recognition, early intervention, and comprehensive supportive care are essential to improve outcomes in patients with shock. Treatment strategies should be tailored to the specific type and cause of shock, as well as the individual patient's condition and comorbidities.